Hello, my name is Christina. I'm going to be your student nurse today. I'm going to go ahead and close the door for privacy. I was going to do a head to toe assessment on you, if that's okay. What that is basically going from head to toe, just making sure everything is working properly. Is that okay?
Yeah.
Awesome. Let me go ahead and wash my hands and put some gloves on. Can you tell me your name and date of birth?
Janessa Rodriguez, July 26, 2005.
Perfect. And do you know where you're at right now?
The hospital.
And do you know why you're here?
I hurt my knee.
Okay. And what month is it?
September.
Okay. You said you hurt your knee. Which knee is it?
Right.
Your right knee. And from a pain scale from 0 to 10, 0 being no pain whatsoever, 10 being the most pain you've ever felt in your life, what is your pain level at?
Like a 3.
A 3. And is that tolerable for you?
Yeah.
Okay. And when can you explain your pain for me? Is it dull or sharp pain?
Dull.
Okay. And does it radiate or does it kind of just stay in one location?
Stays in one spot.
Okay. All right. And before we get started, I want to ask you a couple questions. What's your living situation like? Do you live in a house, an apartment?
A house.
A house. And you live there with your family?
Yeah.
Okay. So you have a support person, someone that's going to help you take care of you when you leave here? Perfect. And do you currently work?
Yes.
Where do you work?
Starbucks.
Oh, that's awesome. I love Starbucks. I love it. Awesome. And do you have any fear or anxiety about being here?
No.
No? Okay, perfect behavior. I'd want to get out of here too if I were you. I'm going to go ahead and start with your scalp and your head, okay? If that's all right. Just check your scalp, make sure your skin is intact. Perfect. Feels great. Okay. I'm going to go ahead and start with your ears. Take a look inside, okay? No drainage, skin is intact. No drainage, skin is intact. Okay. Your skin looks appropriate for ethnicity. That's great. I'm going to check your pupils, okay? Just go ahead and look straight forward. Okay, and this side. Okay. Pupils are equal in size, round, and reactive to light. Go ahead and take a look at my pen, up at the ceiling, my pen, and up at the ceiling. Okay, perfect. Pupils are accommodating. I'm going to go ahead and take a look up your nose, okay? Perfect, no drainage. Awesome. And go ahead and open your mouth and stick your tongue out and say ah. Okay, mucous membranes are pink and wet. Looks like the dentition is good and the tongue, perfect, no thrush. Awesome. Go ahead and close your mouth and smile for me. Facial symmetry is intact. Great. I'm going to look for turgor. Okay, there's no tenting, so the hydration is good. Okay, I'm going to go ahead and lift your arms up for me and back down. Perfect. Go ahead and try to pull your arms up and put pressure up against mine. Perfect. And then go ahead and try to push down. Push, 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 push. Awesome. And can you bend your arms at the elbows? Okay, great. And wiggle your fingers for me. And wiggle your toes. Great. I'm going to go ahead and squeeze my fingers. Squeeze, 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 squeeze. Perfect. And I'm going to check for capillary refill. Less than 3 seconds. That's great. I'm going to go ahead and have you move your head to the left and to the right. Range of motion is good. That's great. Okay, I'm going to listen to your lung sounds if that's okay with you. Just checking your lungs and see if they're nice and clear. Take deep breaths for me. And one more time. Perfect. All right, now lungs sound clear. I'm going to take here at your heart, okay? I'm going to start with your aortic, which is on the right sternal border, second intercostal down. Okay, scooting on across. I'm going to go to the left sternal border, second intercostal down. This is your pulmonic. Sounds Sounds great. I'm going to go a little bit further down. Fourth intercostal is your tricuspid. Sounds perfect. Okay, I'm going to go a little bit lower. This is your mitral valve. It's going to be on your left side a little bit right below your breast. I have to move it. Is that okay?
Yeah.
Okay. This is on the mid-clavicular line, fifth intercostal down the apical pulse, and I'm going to listen to that for a full 60 seconds. Perfect. I got a heart rate of 70. Your lungs sound clear. I'm going to go ahead and I'm going to palpate your stomach. First, I want to check your bowel sounds first, though, okay? I want to check your gastric reason, make sure that everything sounds okay. Okay. I hear movement in all four quadrants. Everything sounds great. I'm going to palpate your stomach, which means I'm just going to put pressure on it, push around, let me know if you feel any pain, okay? I don't feel any masses. Are you having any pain?
No.
Okay, perfect. Your stomach feels great. Okay, when it comes to bowel movements, when was your last bowel movement?
Like 2 hours ago.
Okay, and what was the color and consistency?
Brown and solid.
Okay, brown and solid. And do you have any vomiting, constipation, nausea?
No.
Are you able to pass gas?
Yes.
Okay. Let's see here. Your skin looks great. I don't see any ecchymosis or petechiae. I'm going to go ahead and I'm going to go into your private area. Before I do that, I want to ask you, the last time that you urinated, peed, what was the color like?
Yellow.
Okay. And was there any cloudiness or odor?
No.
Okay. Any frequency or urgency to pee?
No.
No. Okay. And any pain when you pee?
No.
Okay. All right. I don't see any distension in the bladder. And then I'm going to go ahead and feel your popliteal pulse. I'm sorry, this is your femoral pulse. Okay. That is equal and bilateral. +2. I'm going to feel your femoral pulse. Equal and bilateral +2. Feel your carotid. And the other side. Alright, equal and bilateral +2. I'm going to go ahead and feel your brachial pulses. Equal and bilateral +2. I'm going to check your radial pulse here. Equal and bilateral +2. And your ulnar pulse. Equal and bilateral +2. Okay, I'm going to go ahead and check your private area if that's okay with you. Okay, I'm looking for redness, discharge. Is there any itchiness down here?
No.
No, okay, I see no rashes. Everything looks great. I'm going to go ahead and change my gloves real quick, okay? Do you have any pain in your IV site?
No.
No pain whatsoever? Okay. I see the drainage is intact and there's no edema, no bruising, no swelling. Okay. I'm going to go ahead and check your popliteal pulses this time. Equal and bilateral +2. I'm going to check your posterior tibial pulse. Equal and bilateral +2. I'm going to check your dorsalis pedis. Equal and bilateral +2. Okay, and I know that you have pain in your knee. Are you able to move it up at all?
A little.
Okay, can you try to bend at the knees for me? Okay, perfect. And back down. Okay, and I want you to go ahead and try to lift your legs up and put pressure on my hands. Okay, push, push, push. Okay, and then do opposite. Push, 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 push. Awesome. Okay, skin color looks good. Hair growth looks normal. Do you have any calf tenderness back here?
No.
None whatsoever. Okay, and your before you came into the hospital, what was your previous range of motion? Level of function? I'm sorry. Were you walking around okay? Did you use any assisted devices, wheelchairs, crutches, anything like that? No. Okay, perfect. Can you wiggle your toes for me? Okay, great. And then can you flex your heels for me? Try to pull your toes up to the ceiling and push them back down. And can you do that with your hands for me? Up and back down. Great. Awesome. Okay. And then are you able to turn on your side for me?
Yeah.
Okay, go ahead and do that. I'm going to check your lung sounds back here. Okay. Perfect. Lungs sound clear. I'm looking for your bony prominence areas. I don't see any non moisture. I don't see any moisture. I don't see any petechiae. The temperature feels great. There's no moisture. Skin's dry and warm to the touch. There's no non-blanchable redness. There's none of that. There's no rash. I don't see any of that. Looking at your rectal area, I see no hemorrhoids, no rash. Everything looks great. Are you able to turn back over for me?
Yeah.
Perfect. Okay. And before I'm done, is there anything else I can do for you?
No.
Okay, perfect. I'm going to go ahead and lower your bed. Raise your side rail up. I'm going to give you your call light, okay? So just reach out to me if you need anything whatsoever, okay?
Okay.
Awesome. Have a great evening.
You too.
Thank you.